Hello and welcome to the Community Voice. I'm Fara Sax. Today's episode is sponsored by Floridian Furniture. For all your home furnishing needs, family owned, 55 years, helping the community. So give them a shout out. Tell them Farah sent you. Talk to Benny. His number is 305-448-2639. And today, I have the wonderful pleasure of speaking with Dr. Humberto Jimenez.
Yes.
He is with Optum. Welcome, and thank you for taking the time out of your busy schedule to come and talk with us today at Community.
Of course. Thank you so much for having me. I'm happy to be here.
And we have to say a big shout out because today is Doctor's Day. But isn't every day Doctor's Day?
Right? Is it? Yeah, it should be.
Especially now, I think with the past year, I think we really have a new appreciation.
I think I appreciate that. Yes. It's been a difficult year for all of us. And I think that, I'm really thankful that my colleagues have really stepped up and worked through this pandemic. They've been putting in long hours, really trying to get people to understand how things are evolving, and trying to make a dent in this, in this pandemic. And
one thing I must tell you that I have only known the doctor for a very, very short time, but he is so accessible, and I think that is really a kudos to you and to Optum and just as family practitioner, I think that's what we want. We want to feel comfortable. We want to feel held. We want to feel safe, especially now during these uncertain times, or hopefully we're moving forward in our direction forward.
Yes. I think that, I'm really happy to be a family physician, especially during these types of situations, because before the pandemic, we've established all of these connections with patients. And we're really seeing that, come to fruition, how important it is to be involved with a primary care provider. Having the accessibility is extremely important. And I think at Optum, we are striving to make sure that people's questions are always answered, and holding their hand through this process.
And I think you're doing a great job at not only holding the hand to your patients, but you're also become like a little rock star on the webinar circuit.
I'm a rock star. Thank you. I appreciate that. I think you're my only groupie, but I appreciate that.
You only need one, right?
Exactly. So I've done, right. So the health department asked me to speak during this month, because aside from just COVID, so primary care physicians deal with preventive medicine, of all types.
And this month, but every month, I think, is a screening for colorectal cancer.
Oh, yeah.
And I think you brought really a lot of awareness and good information. And I hope you share that with us today during that presentation. What did you think was the most important message regarding screening, especially during the past year that we've really encountered?
Yeah, we've seen people sort of shy away from person-to-person, face-to-face interactions with not just other people in general, but also with their providers, with professionals, with medical professionals in particular. And some people have, unfortunately, been reluctant to care for the other health aside from just trying to stay away from COVID. Now that we have a vaccine, now that we are slowly but surely stepping out back into normalcy, we are trying to convey the message that it is time to go back. It is time to see your providers, engage in those preventive measures that keep us all healthy, that the data shows keeps us all healthy, right? I think that's another thing that's come out of the pandemic, is that a lot of people have, really begun to understand medicine is not just, it's evident there's science behind our message. So there's a lot of data that backs our every recommendation, and the reason that we advocate for screenings is because there's evidence to show that screenings do lower the risk of invasive disease as it pertains to colon cancer or breast cancer, or I mean, you've seen what it's done for cervical cancer, where that's almost unheard of at this point, which is it's great. I mean, it's one of the great triumphs that we have, and now during, like I said, now that the pandemic is kind of, well, hopefully begins to wane even further. We want people to feel comfortable, to know that best practices are being used for by the different places where they will get care, such as, for colonoscopy. Our GI partners are extremely cognizant about the importance of maintaining the CDC recommendations, maintaining social distancing and hand washing, and making the place where people will get care as comfortable and as safe as possible.
Because I heard, it's early detection is really the first line of defense.
Oh, yeah.
But although rectal cancer really is the second cause of death of cancers, is that right?
Yes. If you
is it symptomless? Is it
exactly? So what happens is most of these cancers, the reason we screen is because when they do present and we can make a real dent into their progression, they are symptomless. They, by the time you get to showing abdominal discomfort or diarrhea or weight loss, it's, you're really dealing with something quite advanced, something that, requires serious intervention. And what we want to do is prevent that. We want to make sure that everyone and people, definitely in our clinic at Optum, and people who are seeking their general primary care on a routine basis, they have access to the specialists that can perform these procedures, eliminate polyps early, and hopefully
absolutely
prevent.
Absolutely. And I know that I had to go for a colonoscopy and I was putting it off, but I got the little lovely letter that said, now is the time. And I was really kind of scared, but then I thought, what could go wrong beyond this would be even more catastrophic if I didn't make the next step for myself and
absolutely
healthcare.
Yes. And people at average risk, so they may have taken a year break, but that's okay. We understand. At this point, though, it's important to lessen the risk as much as we can, and
go out and make your appointments and do whatever you need to be proactive for your own care.
Absolutely. Yep.
So are you also wearing another hat, giving vaccines?
Oh, yes. So
tell us what to expect.
So we're very lucky in that we were able to partner with the health department to be one of the, the private organizations that were providing this service to not just our patients, but also to the community at large. We turned one of our senior centers into a vaccination clinic, had our physicians volunteer their time, had the staff also volunteer their time, the nurses, the medical assistants all came in and pitched in, and we're still in the process of vaccinating, waiting for more batches to come. And but we were, it really, it made us very proud, and also, it makes our whole experience so much better. I think I'm really happy that we were able to do that.
And yet people are kind of like on the fence, a little nervous, not knowing what to expect. Because I was reading a statistic, only 29% of the people have received one or their first batch of dosing.
Yes.
So how can we get them off the fence? Because I want one of those pins that said, let's beat this. I got my COVID-19 vaccine. Can I get a button too? What do you think, Diana? Can I get one?
We'll get you one when you come in to Optum and get your vaccine. Absolutely.
It's like the Mickey Mouse Club. I want to be part of it.
Yeah. So I think the message is getting out. I think, there's been greater availability of the vaccinations. So that's been definitely it's been a good push forward, get people a little bit motivated. The more people that have been vaccinated and have had pretty benign experiences, I think helps to improve public confidence in the vaccination. The infection rates going down has been, it definitely has boosted morale. We At our clinic, we have such a high. I don't want to brag about the percentage of patients that are vaccinated.
Oh, come on, this is your time. Come on, let's do it.
So we have a great we've had a great turnout, and we're really happy about that. And we've really pulled out all the stops. We've been shuttling people into our office.
Where exactly is the office? Maybe you can tell us in case people want to reach out to you.
Yes. So I'm actually the lead physician at one of our 4 centers.
And this is the one that's in East Kendall.
Exactly. So we're right next to Norman Brothers on 77th and 87th Avenue. We permeate throughout the city. We have centers in Little Havana, in Hialeah, and close to the airport. We've got a center. But we concentrated our vaccination efforts in the Little Havana Center because we have an associated senior center. So that senior center was pivotal in giving us that space, allowing for our regular patient care to continue on the other side, and have people come in for the vaccinations there. So it was very helpful. And we recently also started vaccinating Hialeah. So we also have a senior center there. So as we have more availability of vaccines, we are able to, deliver more vaccinations. So
do we need to be a patient to come to
No.
Optum? How does that work? And maybe you can give a website or a phone number that our audience can reach out to in case they're in need of a vaccine or two.
Yes.
Or your
two.
help as a primary caregiver.
Oh yes, of course. So so you don't have to be a patient to get a vaccine with us. The commitment we made with the health department was to make sure that we would make a dent in the pandemic, and I think we've been successful at doing that by inviting frontline workers. We vaccinated tons of police officers and firefighters and nurses and teachers.
And Miss Universe, right?
And Miss Universe.
His claim to fame is Miss Universe.
We did.
Sorry, that's a sidebar.
We did have Miss Universe 2016 come in to get vaccinated. I hope she doesn't sue us.
You're blushing.
But it was So we've had lots of people come in, and so our website is miami.optum.com and or miamioptum.com. And our number is 305-260-7506.
Say that again.
305-260-7506.
So they can reach out to you for a vaccine or information or coming in to see if they need a primary, because these are really
absolutely. Thank you. I appreciate that.
Very approachable. Let's talk about the model of practice care of Optum. It's really interesting because it says you make a difference, and you're under the umbrella. Let's just get this straight. You're under, because it's a little confusing even to me. United Healthcare,
right? Our parent company.
As your parent company, and you're one of the arms.
Yeah. So we're
legs.
Right.
Yes.
So we're part of. So there's United Healthcare has both an insurance arm and a healthcare delivery arm. So we are part of the healthcare delivery arm, as is WellMed, Optum, and quite a few others. So it's nice to have their backing through all these endeavors. It kind of facilitates the level of care we're able to give to patients. We are also accredited with the Joint Commission, who does accreditations for hospitals and such. So the facilities are up to that level, and we're very proud of that because it's a difficult accreditation to obtain. So we worked for some years on that, and so we're a medical home. The majority of our patients are over the age of 65, Medicare age, but we do provide care to everyone as family physicians. We have patients sort of 18 and up, and with all sorts of medical issues. So, and our model is basically, we have the provider as sort of the center of actually the patient is really the center of the care. And we have the primary care doctor sort of directing the care around them. And so to that, to accomplish that, we have different professionals that help us. We have a nurse, we have a registered nurse or nurse practitioners at each site. We have social workers. We have case managers who are nurses that follow patients both in and out of the hospital, make sure that they have a smooth transition out and are healthy after acute events. We have my medical assistant, so Yadi is here, Diana, who.
And then how many other doctors are with you in your
Right.
in your center?
So we have, so I'm the lead, and there are 3 other physicians at my center, and all excellent providers. One of which provides lots of women's health, so Pap smears and such can be done in-house. We have other services as well. We have massage services. We do X-rays and things in-house. We have massage therapy.
So it's a one-stop shop, really.
Pretty much. I mean, we're really bringing that medical home, theme, bringing it home. So I think patients, especially, after a certain age, sort of, they deserve and demand a certain level of convenience, and we're happy to be able to bring that to them.
And there's a connection right now with WellMed,
Mhm.
and how is Optum associated with WellMed?
So again, WellMed is another partner. It's one of the healthcare delivery partners, and it was our name prior to this new rebranding that we're doing with Optum. And it is, so WellMed, which started in Texas, developed a very effective model of care for treating patients who were Medicare Advantage patients. So how to treat the seniors in a way that was both caring and respectable, and and a very high level of care. So people enjoy their golden years without having to be to have to deal with all these chronic illnesses in a negative way. So yeah.
And what areas do you serve through Optum?
So Optum is sort of United Optum, the parent company. It's all over the United States. We
and locally here, where can people find you here?
Yeah. So here we're either at either my office or on close to Norman Brothers on 87th. Or there is on 103rd, I believe it's in Hialeah, and 29th and 8th, Southwest 8th Street, and then close to the airport on 57th Avenue.
And then that brings us to home. You said home earlier. So there's going to be even a new home.
Yes.
An additional home.
Yes.
A big home.
Our big home, our coming home. So
welcome home. Let's keep going.
Yes, right. Right. So we are Optum. Our name officially is Optum Westchester, but we are not quite in Westchester, as you can tell by the address. Yes. And that's by design. In fact, design is the reason. The design of the new building is the reason why we're taking a little bit of time to get over there. But we are building we will be occupying a space on 92nd Avenue and Coral Way. That is, it's going to be a huge facility with our own adult senior center.
Wow.
So yeah, we're excited about that. It's going to be great. It's going to be again. So it's funded through our foundation. So you won't have to be a patient necessarily to come to our senior center to engage in in the classes, and lots of wellness classes, things like art and music, and we're gonna have a cafe. It's gonna be really nice, actually.
It's gonna be like
I feel like I'm crying.
It's gonna be like a home away from home.
Exactly. There you go.
Let me just leave, yeah. And there's going to be an independent living facility next door.
There is.
And Med Square. And
exactly. So the project is called Med Square, and the contemporary is going to be independent living facility for patients of a certain age, that probably age 65 and above, and they're going to be providing sort of like concierge service. It's going to be really nice over there, actually. I mean, I'm thinking about moving in as soon as I can.
I'll take one. I'll take a partner too.
Yeah, it's gonna be very nice. So
How big is it? How big is the facility?
So our facility is going to be about 15 to 16,000 square feet.
Wow.
So it's going to be pretty large, and enough to incorporate all our ancillary services in house, and then we'll have the senior center and cafe for recreation.
I think you like that part.
I really like that cafe. I'm big on. Well, you've been to our office, and you know that there's always a cafecito time. So
isn't it about time? After we finish here, we're going to go get one. Okay?
I think we should.
That's wonderful.
Yep.
Yeah, it just seems like it's a really wonderful opportunity for the community to really come together and in a different way. I mean, it seems like it's a different kind of project than what you've experienced so far and what we've seen in our community thus far.
I think so. I think, again, with our efforts with vaccinations sort of becoming more integrated with everyone around us and not being so, not having the sort of like insurance thing sort of separate us. I think we're trying to make a difference and become more involved. We've done projects as well with Alzheimer's Association. We've presented cases with them and food pantries and things. So we're trying to get more and more involved. We have a great liaison for that. Shout out to Becky, who is doing a great job with getting us connected. And I think that So and a lot of time, and the time that we participate in these things are just volunteer time. A lot of our, I think we kind of have that mindset in the office that we all want to contribute, and
you've really contributed as a first liner for us, and I want to say thank you for doing that and being on the front lines, and he sighs very heavily. And I always, anything else you want to tell me in our time that we have?
It's funny because you thank me, but I feel like it's, I was just ready to go. Like once, we have an emergency, as physicians, we're sort of trained to react, respond. And so when I get to things like, it makes me a little bit kind of, I don't know, I feel like I don't know how merited it is, I think. But then I think about what the reaction I had from my employees about volunteering to vaccinate people, really put themselves in situations that, even though there's PPE, and I mean, it's really something that you really have to say, this is my commitment.
And I think that it's a calling. Anybody that works in the healthcare field, it's really a calling. It's a vocation. It's something that's in your DNA and your blood.
It really is. I mean, And
I can see your excitement through this plexiglass here.
No, because I've seen this happen throughout the pandemic, where we said, well, now we have to screen people for COVID, and we have to do nasal swabs and do all these things, and so things that were new to us, and there's been like no hesitation. In fact, I have so Yolanda, my nurse, always surprises me, because I said, well, so now we're gonna go ahead and start doing these initiatives, and she's like the first one to say, this is why I became a nurse. I mean, that is the response I get from my people, and a lot of people don't have that in their lives, that passion, that calling, that desire, right. and I just feel that from you. I really do, and I really appreciate that. My question is for a physician: what is your legacy? What do you want people to know now in the future about you? So I think that wow,
it's not heavy. That's not on the list, right?
No, it was not. I did not prepare for this. So this was. I mean, so I think that we all go into it to make a difference, and we don't really know what form that is going to take, and we had no idea. I think that it was going to be as big as COVID was, as big as the pandemic was. And I think that I want my legacy to just be, I want people to know that I was grateful for the opportunity, and I just hope that as a leader in my office, we were able to achieve that. And I just so
And we are grateful.
Thank you.
Thank you. I really appreciate it. I want to thank you for your time
Thank you.
and your commitment to us, and only good things in your new home with the cafecito. And I will have one together. Okay?
We will.
Yeah.
You'll be invited whenever you want.
Thank you. I want to thank you for joining the Community Voice. Follow us on Facebook and Instagram. And again, thank you to our sponsor, Floridian Furniture. Have a great